a webinar that will focus on Sudan. My name is Nadine Ferris-France. I'm the Executive Director of the Irish Global Health Network. There is interpretation for this webinar, so if you would like to hear everything in English, please go to the bottom and select the interpretation button and select English. Si vous voulez écouter en français, il faut pousser le bouton tout en bas, français. Before we begin, just a few of those ordinary points. A recording of the event will be made available on the IGHN website after the event. Live streaming is happening right now, and welcome if you're joining us by live stream. Any questions during the event, please use the the Q&A feature, and we would love for you to just continue to share messages, to tweet, and to share as you can. You know, July 2024 marks one more year of the ongoing conflict in the DRC, and it just continues to endure a prolonged and devastating conflict. Decades of violence. For those of us who've been in development, we are familiar with this. Decades of violence driven by armed groups competing for control over the country's many natural resources have led to catastrophic humanitarian crises. In the past year alone, the conflict has claimed the lives of more than 10,000 people and left thousands more injured. You know, some of the statistics, even reading in preparation for this, the violence has forced more than 1.7 million people to flee their homes, adding to the already worrying number of internally displaced individuals, which now exceeds 6 million. And nearly 27 million people, approximately 1/3 of the country's population, require humanitarian assistance to survive. 27 million people. In the eastern provinces of Ituri, of North Kivu and South Kivu, the situation is particularly critical. Over the past 3 months alone, up to 200,000 people have been displaced from these regions due to the escalating violence and insecurity. And the DRC now hosts one of the largest internally displaced populations in the world. So this situation remains critical. Ongoing conflicts in various regions continuing to cause suffering for civilians. And today, this webinar, we aim to share awareness of the continuing crisis in the DRC and hear from our expert panelists who will share their insight and their experiences. And, you know, I just would say if there's other development specialists like myself, as I said, we're all very familiar with the idea that there has been conflict in the Congo for so many years, but we don't know enough. And I certainly don't know enough about what's currently happening. And I think it's on us to really try very hard to understand that and do what we can. Just to remind everybody before I introduce the speakers, interpretation is available. If you would like to hear this conversation in English, you must select the button in the interpretation feature English. Si vous voulez écouter en français, il faut pousser le bouton interprétation français. So let me, without further ado, introduce our speakers, and thank you so much for your time, each of you. First of all, I'd like to introduce Isidro Carrion Martin. He is a public health epidemiologist with a background in nursing, has a master's in international cooperation and economic development, public health. He started working with MSF, Doctors Without Borders, in 2009, and he's been working remotely supporting projects in the DRC since 2011, both as a nurse and an epidemiologist. You're extremely welcome, Isidro.
Hi.
Hi, and
Hi, everyone.
Hi, and joining Isidro on the panel, we have Edwin Kireri. She is an activist for the rights of women and girls in the DRC. She's graduated in public international law from the Protestant University of the Congo. She's worked with the organization Solidarité Féminine pour la Paix et le Développement Intégral, an organization that defends and promotes the rights of Congolese women since 2016 as a project manager. The organization has a one-stop center, a gynecological obstetrician clinic, medical center, which takes care of survivors of gender-based violence. Edwin, thank you so much for joining us. The third panelist we have.
Merci beaucoup.
You're very welcome.
Merci.
The third
Bonjour à
panelist we
tous.
have Paolo Sordini. He has a background in hydrogeology. And Paolo has extensive experience in hydraulic engineering and water sanitation wash interventions. His journey with Concern Worldwide started in 2020. He covers the role of wash advisor in the DRC for 3 years so far. Since the end of 2023, Paolo also joined the Surge team in Concern as the WASH program manager. So welcome to all of you. And I might just ask Isidro, I might start with yourself, just as always, starting with the background of what do we know and the data. In your role as an epidemiology advisor with MSF, what are the most pressing health concerns that you've encountered in the DRC, and how is the ongoing conflict impacting these issues?
Mm. Well, maybe the first one that I would mention is sexual violence, as it is one of the health issues that we as MSF are trying to prioritize, and also one of the ones that I say is most impacted by the conflict. There are no statistics on sexual violence that will provide a complete picture or a precise prevalence. There is shame, fear, stigmatization, and many other obstacles that prevent women victims from seeking care and treatment. So we don't really know how many women are out there that need care and are not receiving it. But getting immediate medical care after sexual assault is critical in order to limit the potential consequences. And to give some numbers, in the displaced people camps of Shabindu, Rusayu, and Elohim near Goma, we treated more than 1,700 new cases of sexual violence in April. 70% of them were perpetrated by weapons carriers, and only 60% of them presented within 72 hours of their attack, which shows that it is still an ongoing medical and humanitarian emergency, and clearly directly related to the conflict, because the precarious living conditions in these camps, with very limited access to food, water, and other basic necessities, put women at a greater risk of becoming exposed to this sexual violence because they have to venture to unsafe areas to seek finance support and finance income. So they have to participate in risky activities in order to access these needs. And the other one that I will mention is more like the group of the outbreak-prone diseases, such as measles, cholera, or the most recent mpox outbreak. Starting with measles is one of the most contagious diseases in the world, and despite the fact that there is a effective and a vaccine that provides almost complete protection, the DRC vaccination programs are not able to ensure the adequate coverage to prevent the outbreaks. And this is the result of geographical access challenges, the country's high birth rate with many new children coming in every year, and of course security constraints provoked by the conflict. We have every 2 to 3 years big measles outbreaks affecting tens or hundreds of thousands of children in DRC. And in these outbreak situations, the health system is not able to provide treatment for these children, and as a result we see many preventable deaths. For example, in 2023 we had 6,000 measles deaths. For cholera, it's a similar situation. It's endemic, so in some areas of the country there are always sporadic cases that are regularly reported, but the situation is now extremely concerning due to the high number of people living in these overcrowded displacement sites and the recent massive waves of displacement in the eastern part of the country, where the level of hygiene and sanitation and the access to safe and drinking water was clearly inadequate even before this conflict restarted. This has led to massive cholera outbreaks in the last 2 years. For example, since the beginning of the year, we treated more than 3,000 cases in only one of our facilities in one of these camps in Bulengo camp near Goma. And then the last one that I will mention is the mpox outbreak. Mpox is also a disease that is endemic in DRC, but in the last couple of years, and particularly this year, cases has gone up exponentially. And the disease is now spreading in many other areas, in many other provinces that were not reporting cases. I think we went from 11 of the provinces reporting cases in previous years to 26 of them reporting cases now. And only this year there have been more than 13,000 cases and almost 500 deaths. And this is an alarming situation because there are not enough resources in place to stop this disease, and it will continue to spread, and more deaths will occur. And there is also a big risk of for international spread and the risk for another big pandemic. And maybe I'll leave it there for now.
Yeah, thanks, Isidro. You paint a bleak picture in terms of, all of the major public health crises, and again, I think just to stress that it's not once-off issues. It's epidemics that continue again and again. They're coming back and back every year. How even in terms of MSF, I mean, most people are familiar with MSF, but how are communities working with MSF then to, just to try and support this situation, to control the outbreaks, to, work to support the women who are survivors of violence, the stigma you mentioned? How does how is MSF responding and working with local communities?
Well, I think in the relation between MSF and the communities, my experience has always been positive, extremely positive. I actually find Congolese people are one of the most welcoming people I have ever encountered. And normally MSF teams are very well received because the work we do is highly appreciated. I would say MSF is one of the organizations that is best considered in the DRC. We have been around for many years. We have been running large-scale projects since 1997. Also, the fact that we have the capacity to react quickly in different crises, as we react independently fast. We don't rely on big funders. I think this also improves our relation with the community. But of course, we have also encountered some issues with communities that were not super happy with the way we were doing things. In my opinion, this was mostly because we have not engaged enough with those communities, and they were somehow right to be not happy with us. I think the last year we are really trying to do things properly and engage with local communities with the ambition to co-design projects, programs with them, really like sitting down with them since the very beginning. And there are still many things that we need to improve, but we are trying to move as much as possible on that direction. And everyone is very aware now of the need to really engage with all of them, with all the components, the people in those communities.
Mm. And Isidro, let me ask you, I mean, you've been working with in and with the in the Congo for a long time. I mean, what do you see in terms of change? Do you see any change? Are there some things that are improving in terms of how, I don't know, how responses improving, or do you experience it as just an ongoing cycle of public health, different public health and social challenges?
Yeah, I think there is an ongoing cycle of this series of challenges. I think there is also an expertise in DRC. There are like local colleagues with an amazing expertise, international experts in their topics, like Ebola or Mpox now, for cholera, for giving some examples. So there is a lot of capacity in those countries in terms of like human capital, if you like people who are very good, but it's always the lack of resources, right? And exacerbated by this conflict and the fact that maybe if there is a structure that is put in place, for example, the Ebola response structure was impressive and was like very well coordinated at the end with plenty of gaps, but at the end there were like very strong teams, very well organized. But now we see that, for example, in the Mpox response, this structure is really struggling, and there are plenty of gaps, and the structure is not in place at all, and they are still waiting for the resources and the international support to come in.
I mean, when you say it like that, you can imagine, I'd say, people listening can remember, everybody has that experience of COVID and the struggle to adapt and respond. And as you speak of, our friends in the Congo and how this has been a cycle of trying to respond to the next outbreak. And as you say now, Mpox being the latest in that. Is it just, one last question for you, just around I guess what are the most important areas for the international community, and to be able to support public health efforts and to improve things, and really encourage you to be as always MSF staff are as transparent and as honest and as direct as you can be. I mean, what can people actually do that's going to help, or perhaps a better question is, what should they not do?
Yeah, yeah. Well, in terms of what should they not do, maybe starting by the conflict itself, like we are talking here about the impact of conflict in health. So we continue to remind all warring parties that in times of conflict, they are required to respect international humanitarian law and all protections afforded to civilians, and that is not happening now. So perhaps in that regard, I think the international community should or could try to support this call in a more active manner. And then on the public health front, I don't know where to start, because there are so many gaps, as we were saying, and maybe talking about the same priorities that I mentioned before for sexual violence. Obviously, more programs for survivors are needed. As I said, we know the numbers in our facilities, but we know that many of the people out there where no adequate services are available. And that is unfortunately the case in many places in DRC. No adequate services are available. And also in the places where we work, we provide medical and psychological care to survivors, but there are very limited options for other actions that are required, like legal support for these victims, safe shelter, and other protection services. And for outbreaks, diseases, for measles, the adequate vaccination programs remain a massive challenge. They should be a priority. And also treatment capacity for the affected children. For cholera, I guess Paolo will explain a bit more, but obviously like wash facilities and access to safe water, especially in these IDP, displaced people camps, should be a priority. But also adequate vaccination for cholera and enough vaccines, as there is a vaccine that is very effective and preventing the disease, but the global stocks are very low and are not enough to respond to outbreaks or to organize preventive vaccinations in all the places where these are needed. And finally, for the MPOX, a massive and well-coordinated response with massive resources will be needed to fill the many gaps that I was mentioning at the beginning, like improving lab capacity to test patients. We're still struggling with this. For example, in one of our facilities in Uvira in South Kivu, where we've been supporting for the last 6-7 weeks, and still struggling with the basics, with lab capacity. Surveillance and contact tracing, isolation or capacities or support for non-severe cases to self-isolate somehow. So, and also very important, the vaccines for Mpox, because once again, there is an effective vaccine, but there are no vaccines available for DRC. And the General Secretary of WHO, Dr. Tedros, yesterday or a couple of days ago, he put it in his social media that he's quite concerned about this Mpox outbreak, and he's considering calling the, what do you call it, the public emergency of
Right.
international concern.
Mm.
So hopefully that call will come, and there will be more
Yeah.
resources coming in. Yeah.
Yeah. Yeah, thank you, Isidro. Yeah, I think you've painted a very realistic but bleak picture of the situation, but also just hopefully just people listening in terms of what can be done and where the efforts need to be. I was just really struck by, you mentioned talking about gender-based violence survivors, and Edwin, coming to yourself and your extensive work with Solidarité Féminine pour la Paix. I mean, Isidro mentioned 1,700 women came forward in April alone, having been affected or reporting gender-based violence, and that's obviously only the women who've reported that, which as we know there would be more. Can you say just a little bit, even broadly, about how this ongoing conflict has impacted the rates of gender-based violence? Help us understand a little bit more the forms, the context of violence, and the challenges that these women and survivors are facing.
Ok, merci beaucoup. Alors, comme vous avez dit, je travaille avec Sofepadi. Sofepadi qui est une ONG féminine de droits congolaise et qui a commencé à travailler pour la promotion des droits de la femme depuis 2020 et depuis 2010. Nous avons le centre gynéco-obstétrique Caribou Niwamama à Bunia dans lesquels nous sommes en train de prendre, donc de faire la prise en charge médicale des survivants des violences sexuelles. Et c'est vrai, les conflits sont une des causes qui fait augmenter les taux des violences sexuelles et des violences basées sur les genres en RDC. Et ça, c'est d'abord, premièrement, au travers les mouvements des populations. Et nous avons en Ituri beaucoup de sites et la majorité des sites sont spontanés et ils ne sont pas organisés. Et vous voyez dans les sites, ceux qui peuplent majoritairement les sites, ce sont les femmes et les jeunes filles. Et quand vous voyez la promiscuité dans laquelle elles vivent, et ça, c'est en train de défavoriser les violences sexuelles. Et aussi, vous trouvez beaucoup de femmes qui sont victimes des violences sexuelles liées au conflit. Elles sont peut-être elles sont des fois violées parce qu'elles font partie peut-être d'une ethnie qui est groupe rebelle. Et vous voyez, ce sont par exemple les militaires qui viennent les violer en disant que nous voulons vous punir parce que vos frères sont en train de prendre des armes et tuer les autres. Et soit elles sont violées parce qu'elles sont d'une ethnie qui est pourchassée et on les viole pour cela. Et soit carrément, vous, on peut même les accuser d'avoir aidé les autres femmes. Parce que nous avons reçu au centre Caribou Niwamama plusieurs femmes qui ont été libérées par d'autres femmes. Donc, les femmes qui étaient en train de, lorsqu'elles partaient faire le marché, celles qui étaient retenues comme esclaves sexuelles, et lorsqu'elles partaient faire le marché, d'autres femmes de cette ethnie vont dire, bon, nous allons essayer de vous libérer pour que vous puissiez vous en sortir quand même de cette situation. Vous voyez des choses comme ça. Et aussi, nous notons aussi que surtout dans des espaces contrôlés par les groupes armés, ils, ils sont un peu ils sont un peu de groupes religieux, ils font des spiritismes et qui laissent deux fois aussi, ils font donc si je peux dire, des rites qui sont là et qui sont entrés, par exemple, dans les rites, on leur demande de violer les petites filles, de violer les filles de 2 ans, parce que nous avons aussi reçu des fillettes de 2 ans qui ont été violées. Et vous voyez, les groupes armés, ils sont en train de faire ce genre de choses. Et malheureusement, tout cela, dans toute l'impunité, ces femmes n'ont pas la force d'aller dénoncer parce qu'elles ont peur des représailles. Elles ont peur donc elles ont peur d'être tuées après, elles ont peur que leur famille subisse des représailles parce qu'elles ont dénoncé les violences sexuelles. Mais aussi, nous pouvons encore ajouter, il y a encore des coutumes rétrogrades, des coutumes euh, qui exacerbent les violences faites aux femmes. Donc, d'une manière générale, et vous voyez, par exemple, dans certains coins, c'est normal qu'une fille de 16 ans puisse se marier, donc il y a des mariages précoces, il y a aussi des mariages forcés, et les filles et les femmes, souvent, ne vont pas à l'école, et les filles sont obligées de quitter l'école pour se marier. D'une d'une manière générale, ce sont là les, donc les violences que subissent les femmes à l'est de la RDC.
Mm. Yeah, thank you, Edwin. It's just very, very complex, as always, whenever we're talking about gender-based violence, but just so much exasperated by the conflicts, as you mentioned. Could you say something about HIV? The intersection between violence and HIV. What are you seeing in terms of the women who are reporting or just the stories, stories coming from the communities around HIV? And how are you responding to that?
OK, merci beaucoup. En effet, comme je le disais, je suis en Ituri Et l'Ituri est une des provinces qui a beaucoup plus de minéraux. Donc, et nous avons aussi plusieurs zones minières en Ituri. Et dans les zones minières, il y a une très grande prévalence du VIH-Sida. Et sans oublier aussi que que les porteurs d'armes, donc la partie est de la RDC, il y a une très grande prévalence du VIH-Sida et très souvent les femmes sont exposées à cela. Et s'ils ne viennent pas avant les 72 heures pour la prise en charge médicale, des fois ça devient un peu compliqué pour les soigner. Alors nous, ce que nous faisons tout le temps, c'est nous faisons des sensibilisations donc en différentes formes. Parce que comme a dit Isidro au début, vraiment la région, il y a beaucoup de violences sexuelles. Alors, pour nous, nous nous disons qu'il faudrait que nous puissions commencer à faire des sensibilisations à la communauté partout dans les écoles pour dire que si une femme, pour donner l'importance de la prise en charge avant les 72 heures, parce que si vous êtes prise en charge avant les 72 heures, vous avez beaucoup plus de chances de ne pas avoir les VIH. Dans notre clinique, nous avons des kits post-viol, donc dans lesquels, surtout celui de moins de 72 heures, il y a aussi des antirétroviraux qui aident à prévenir le VIH. Mais si la victime vient au-delà de 72 heures, là, ça devient vraiment compliqué. Donc, elle a plus de chances d'avoir des VIH.
Yeah, thank you, Edwin. It just always just showing again just the complexity of being able to provide what's needed to the people who most need it. Edwin, just from your perspective, you're running a one-stop center specifically focused on gender-based violence and all of the things around it, as we were touching on here. But what would you say is needed in terms of what would you need from the international community and also from local organizations, specifically to be able to better address gender-based violence in the context of the conflict?
Oui, oui. Vous savez bien que les les organisations locales, elles sont beaucoup plus ancrées dans la communauté parce que très souvent, les organisations locales utilisent les personnes des communautés locales. C'est plus facile, par exemple, pour une femme de s'adresser à une autre femme de sa communauté parce que elle sait, elle sait que cette femme-là va mieux la comprendre parce que la femme elle-même, elle vit aussi les situations dans laquelle cette survivante qui est devant elle vient. Et nous demandons, pour moi c'est un plaidoyer, si beaucoup plus les organisations internationales commençaient à travailler avec des organisations locales, surtout les organisations féminines. Parce que plusieurs organisations féminines en RDC travaillent de leurs propres moyens. Ils ont de l'impact sur le terrain, mais ils n'ont pas assez de moyens. Mais aussi, si on pouvait aussi travailler sur le renforcement des capacités de ces organisations. Aujourd'hui, nous sommes la Sofepadi, nous étions nés à Bunia dans la province orientale, mais aujourd'hui, euh, nous avons des actions à Goma, au Nord Kivu, nous avons des actions à La Chopo, nous avons des actions au Haut-Ouélé, nous avons des actions au Tanganyika. Et, vous voyez, et puis, c'est une organisation qui était créée par des femmes euh, de Bunia exactement, mais qui aujourd'hui, même au niveau de Kinshasa, au Congo central, nous avons des actions, nous faisons la promotion des droits des femmes et de jeunes filles. Et si plusieurs organisations pouvaient travailler ainsi avec des organisations locales, essayer de les renforcer. Nous avons travaillé à nos débuts avec MSF. MSF nous a accompagnés durant 3 ans. Et cela nous a permis à voler de nos propres ailes et aujourd'hui à apporter beaucoup plus d'aide aux femmes et Aujourd'hui, par exemple, si nous travaillons avec Trocaire qui nous accorde des appuis ou qui nous permet encore à donner donc la prise en charge médicale à beaucoup plus de femmes. Si les organisations ou les communautés internationales travaillaient avec les ONG féminines, je pense qu'il y aura beaucoup plus d'impact dans la réponse, vu que la majorité des personnes qui sont affectées, ce sont les femmes et les enfants.
Thank you, Edwin. That was very well articulated, very well said. Women-led organizations, and also I hear similar theme, Isidro, just in terms of the local organizations and the experience and expertise by locally led organizations. Thank you for that. Paolo, just with the other issue that Isidro outlined for us very clearly was this issue of just the issue of continual outbreaks of cholera and issues around water and sanitation. Could you tell us specifically a little bit about the current situation in Goma, and why have we seen a dramatic increase in internally displaced people in the last couple of years?
Yeah, thank you, Nadine. So in the last couple of years, towards the end of November 22, in the end of 22, basically we found there was an increase of violence due to let's say the coming out or the comeback of the M22 group, that is around the armed group. So basically, this resulted into clashes with the military forces and the existing armed groups. We count about 200 armed groups already in the North Kivu. So basically, this results into clashes and then the huge displacement of people. And basically, this what we see today is that only in Goma and in the surroundings, we find today almost 1 million of displaced people. That's something that was like Isidro was talking about when he was saying Rusayo and Elohim. These are just two of the many sites that came out in the last couple of years. Basically, all the surroundings of Goma are now occupied. So, and the worst part is that where we work as concern in Bulengo area is basically the last site that you have before the front line, where we have still the militaries that are still fighting against this armed group, the M23. So we found ourselves, like all the NGOs and concern, we found ourselves in this situation where we had like hundreds of thousands of displaced people that came to Goma, and we have two axes. One is the north axis to Kanyaruchinya, and this axe where we are working now specifically is the northwest axe. These people basically arrived in Goma in an area which is volcanic, first of all, because we have two volcanoes in Goma. One is Nyamulagira, that is just outside of Goma, and one is the Nyiragongo, which erupted in 2022. So after responding to the first crisis that was in line with related to the Nyiragongo eruption that caused this displacement of about 400,000 people, we then had to respond to this new crisis. So why do I mention the volcanic area? Not just because of course, the existing threats of the two volcanoes, because basically Bulengo is situated between the two areas of influence of these two volcanoes. So the area is full of what they call mazuku. It's basically CO2. It is coming up from the ground, and it's related to the existing activity of the volcanoes. So there have been already deaths among the displaced people. Now to go closer to the question, to the main point of cholera. As NGOs, we need to provide water sanitation. Well, in our case, and also my sector is water sanitation and hygiene. So I will come to water because it's also related to what MSF has been doing in the last year. But for sanitation, considering that you have hard rock, which is volcanic rock, it's very difficult to dig latrine pits. And when you have all these thousands and thousands of people coming in, you know that you need to build latrines as soon as possible, and they have to be emergency latrines. So you have the difficulty of digging, then you have the fact that you have to build quickly, so you cannot build latrines that can be emptied. So that's another big problem, because since the rock is so hard to dig, you cannot easily dig again other latrines. So since the beginning till now, we have been also evolving in providing the displaced people with latrines, because at the beginning we had like hundreds of people for using one latrine. And it was absolutely incredible, the situation. So far, what has changed is that little by little, we have been improving the way we intervene, the way we build our structures, and so we can expose less people to the risk of contamination related to cholera, for coliforms, fecal coliforms, and coming out actually to water. I don't know, maybe not everyone is familiar with the context in Goma, but Goma is just is facing a lake, and basically for all people in Goma, the lake is the main source of water. There is no other source of water. There has been now NGOs have been drilling boreholes, but the quality of water is still a big question mark. Again, because of the existing of the volcanoes. So people who fetch water from the lake, they are exposed to the fact that whenever there is a rain, all the sewage, everything, and I'm talking about not just the displaced camps, but I'm talking about Goma entirely. There is a road that we call a Rue des Poubelles. It's the road of the waste. It's where when there is rain, all the waste is just coming down towards the lake. So you can imagine we have to provide safe water, also specifically also to the displaced people. So MSF last year came out with a more sustainable solution, because at the beginning, NGOs, we were facing the challenge of providing water through water tracking, because not all the camps are just facing the Kivu Lake, because otherwise you could just do bucket chlorination. You could have like chlorination emergency points, but there are people that have to walk kilometers. Therefore, at the beginning of this, and not only at the beginning, because even today we have some camps that are supplied through water tracking, and it's a tremendous activity, because basically it's very expensive. All NGOs started to use these water trackers, these water tanks. So there was basically a saturation in the need and in the demand. So this longer term solution that was put in place by MSF and then we took over is basically a water treatment plant that it's pumping water from the Kivu Lake. It's treating it, we treat it with chlorine, and basically we pump it to different sites. So the water treatment plant is in Bulengo, and we supply water to the Bulengo camp, and then Lushagala, Elohim, and the other sites that a part of them were also centered by Isidro. This allows us to at least have a system that is monitored, because the water quality is checked at the beginning and then also at the distribution sites, so at the treatment plant and the distribution sites. So we monitor basically the residual chlorine, pre-residual chlorine. So we make sure that there is enough chlorine. So water is not only just chlorinated, but we have to make sure that there is enough residual chlorine that can protect from further contamination. Why this? Because since I arrived in 2019 in DRC, actually was with MSF for the Ebola. We were doing prevention, and there was also an Ebola treatment center. But the challenge was cholera as well, because as Isidro already said, cholera is endemic, and we have cycles coming out every year. We have seen it this year. It was like another disaster, because it's exacerbated by the fact that we have displaced people. But Buhimba was already an existing cholera treatment center. Sorry, I got lost.
That's okay, Paolo. It's really interesting. Anyway, we're learning. It's really, really good. It's really interesting. You're painting a very interesting picture. Yeah.
Yeah. Yes, just to finish with this, sorry, because I think my answer took a bit long. Since I arrived here, I realized that the problem is not just the fact of treating and distributing safe water, but it's also the fact of doing the sensitization to the communities, in this case, to the displaced people, about their jerrycans, because you can have like safe water at the tap stand, but then the water, and there are also studies that demonstrated, I think the one was in South Kivu, was from Johns Hopkins University. They did a study about cholera. Like the contamination, it comes even after, when you are keeping like the water at home, for example, when it's not protected, but there is no need. So there is a big work of sensitization, but also distributing like hygiene kits, for example. We want to give soap to these communities because they have nothing to displace people. We want to provide them jerrycans because they also need to have something. They just left their houses without anything. So we want to provide, we were talking about, like, for example, hygiene kits. So we want to provide AfriPads, like recyclable pads, and like anything that is also used for menstrual health. And yeah, maybe just for a link again with gender, I think another thing that we've seen lately is that in this work of seeing this protected crisis, and so seeing the need of adapting from emergency intervention to longer term, we have to think about like the protection like of women. And so we started installing recently like solar lamps in the site where we install latrines. So I think this is an evolving situation. We are also relying a bit different from MSF. We're also relying on donors. So we also our role is also like doing advocating with our donors to find the right directions.
Thank you, Paolo. That was genuinely really just so kind of comprehensive and interesting, that picture, and the mind is just, the boggles in terms of, the next layer of difficulty with, displaced people, one water source, volcano, epidemics, just the whole thing. I wonder, Isidro, listening there, it's interesting, to see the collaboration clearly between, say, Concern and MSF in this instance. What would you respond, Isidro? Anything you'd like to add to what you've heard from Paolo, just from the perspective of MSF?
Well, I'm not a WASH expert, but I've been involved in some discussions about the WASH situation in these camps, and I didn't know that Concern has taken over the treatment plan. That's great, because also I know about all the issues that we had with the, you call it sludge management. So the latrines being emptied, and what you were explaining, right? That you cannot keep digging. So the situation here is quite different. We need to come up with a solution that you can maybe explain better the technical side of that. But indeed, that was a big challenge for MSF, because we were dying to get someone to take that over, because we the way we operate is like we try to respond to the acute emergency, and then we try to find partners to take over our activities in the longer term, so we could keep focusing on the emerging crisis. So yeah, that was, I remember, one of the big issues from the conversations that we were struggling to find. And there was a big discussion, like, should we continue? And the answer was like, as long as we don't find someone to hand over to, we have to keep doing it.
Yeah, thank you, Isidro. And I think, you're saying, like, I'm not a water expert, and I think none of us are except for Paolo, are WASH specialists, and yet it affects every area, every single area of all of what we do. And Edwin, I was just listening to Paolo, thinking about the different gender issues and the issues for women in terms of menstrual health, in terms of safety. I was just thinking back to what you had been saying around gender-based violence. What are some of the ways that women can be safer, and that we can really be thinking about gender issues within, for instance, water sanitation programs or efforts?
Ah oui. Quand par exemple vous voyez les survivantes qui viennent vers nous, des fois vous trouvez qu'il y a, je peux dire dans les statistiques, au moins un tiers qui se font violer parce qu'ils sont soit partis chercher de l'eau, soit ils sont partis faire les activités, par exemple chercher les boîtes de chauffage, la cueillette et tout. De l'eau est très important pour une femme, surtout. Et quand les femmes sont dans les sites des déplacés, et par exemple, lorsqu'elles sont dans leur période de menstrues, ça devient vraiment horrible pour elles parce que, comme Paolo le disait, il fallait avoir au moins même des kits de dignité dans lesquels il y a au moins de bandes hygiéniques réutilisables. Et la majorité des femmes, de jeunes filles, se retrouvent sans ce kit nécessaire pour elles. Et ça devient compliqué. Et de l'eau, c'est non pas simplement nécessaire pour leur corps, mais aussi nécessaire pour, pour les travaux. Donc, au niveau du ménage, on boit de l'eau, on la boit, on prépare avec et tout. Et toutes ces choses, bien qu'en Afrique, ça revient aux femmes de le faire. Donc, et même pour aller chercher de l'eau, c'est une tâche spécifique aux femmes. Et vous voyez, la majorité de sources, par exemple, qui ont été aménagées, se retrouvaient dans des bas-fonds. Et arrivé au bas-fond, il y a souvent des espaces vides. Et ces espaces vides étaient aussi un danger pour ces femmes parce que des fois, elles se faisaient violer durant ces instants-là. Et ça, ce sont des femmes du village et des femmes aussi dans les sites. Elles vivent ce genre de choses qui ne sont pas normales.
Yeah, yeah. Thank you, Edwin. Isidore, I see a question in the chat for you, and people, you're very welcome. Anybody to share a question. It's specifically for you, Isidro. It's DRC is a vast country covered with lots of vegetation, and of course, you well know how the roads and the risk of encountering rebels during your own travels to the camps. How do you get to the most vulnerable communities who are deeper and further in away from your area of operation?
No, that's a very good question, and in fact, often we struggle to get to those communities, and these areas, North and South Kivu, are highly insecure areas where we have had like incidents in the past. So the MSF teams have to be very careful the way we operate. Movements have to be like discussed before and green lighted. There are areas where unfortunately we cannot reach, and for that reason, what we've started to do as well, it's more like a strategy, what we call remote support. And for example, we've been trying to collaborate with obviously with the local health authorities, but also with local NGOs who are working in those areas, and we basically set up the activities with together with them. For example, in South Kivu, we've been using this model in the last couple of years, and responding to cholera and measles outbreaks, sexual violence, in that manner, right? Like trying to cooperate with those local partners, because it is indeed a high. Some of them are high insecure areas that we cannot really send our team there. It is also true that we normally try to get access everywhere. We try to communicate with everyone, discuss with everyone. We've been running operations, for example, in Moeso for many years, and as you might know, Moeso is a city north of Goma, as Paolo was explaining. With the M23 has taken it over a few times, and even even if the city was changing hands in terms of who were the armed forces running the city, like we were still operating in the hospital and in our facilities, but it is a very tricky context for that.
Yeah, absolutely. And Isidro, just as you've been listening, and obviously you've been living this for quite a long time, but as you're listening, and what would you share? Like, what would be your key messages to people who are listening? I guess if people were really tuning in, and again, I would really just say, having knowing that there's conflict in the Congo, but needing to be refreshed in terms of understanding this is serious. These are the things that we need you to know, and this is what we'd like you to do. What would you say?
I don't know. I'd say that first of all, we need to remind people that this is one of the biggest humanitarian emergencies that we've seen in the last years, and unfortunately, it is an ongoing emergency. And I'd say since the late 90s, these areas have been suffering from constant waves of violence, conflict, outbreaks. So it is like really like devastated areas by a series of emergencies, and we really need people not to forget about this crisis, because I often think that other things come in the media and big emergencies in other places, and obviously the attention is deviated. Also, I don't know how the journalists call it, but the fatigue of always hearing about the same places. To say, oh yeah, but that's normal. No, they've always had it there. But it is still like very very sad to witness these situations on the ground, and see that really like international donors or the international community might tend to forget about this often, no? And when you talk to people and explain about what's going on and start telling them the numbers, like I don't know how many, Paolo or Edwin, you might know better than me, but I think it's been like 1 million people displaced in the last couple of years in North Kivu alone, and that is like a massive number of people moving around, and all the indicators, the numbers that I've given before. Yeah, I think we need to not forget about this one.
No, thank you, Isidro. Very well said. And I see another question in there, in the chat, just about and thank you. It's from Mohammed, just asking about Ebola, and asking about the experience. Has the world learned anything from the previous Ebola in West Africa and COVID? And what is your message to the world in regard to this? Coming to the epidemiologist on that.
Well, maybe I'm not sure we have learned enough. I think we're still seeing the same situation with or similar situations with mpox, as I said, and I don't want to sound alarmist, but the situation with mpox, for example, might be like even worse than the previous pandemic we had in 2022. We had another mpox pandemic, but it was a different clade, a different type of virus. This one we are seeing now is the clade that is endemic in DRC, and that is more aggressive. It has a higher mortality rate, and particularly the fact that this is the clade that is spreading in African countries. The other pandemic in 2022 was mostly in high resource countries, so they had the means to stop it, to treat the patients.
Yeah.
But it will obviously be a very different story, and the same story with the vaccines.
Right.
We should have learned from that situation and COVID and the lack of vaccines and the inequalities in the global stocks and the global availability of vaccines, and still we are in the same situation. There were vaccines available, obviously, for mpox when the outbreak was going on in Europe, in Northern America, but now it is DRC don't have vaccines yet as we speak. They are saying that they're going to receive like 65,000 vaccines in the next weeks, but still that will not be obviously enough to stop this. And I'm afraid there will only be an international reaction when there are cases in high resource countries, and when the international community and I don't know, like the politics and the politicians start giving it importance, because they are seeing it on their own door. So yeah, I think we have not really.
We're not learning. We are not learning. It doesn't sound like it. Edwin, just coming to yourself, I was coming to you really just to ask, I guess there's two things. There is a question from Abdul just about who protects the women from gender-based violence. Who's protecting the women when they're carrying out their normal day-to-day activities? That's one question. And then my question to you is just, what would you like to leave us with? What is your kind of key message, for key takeaways for everybody who will be listening, watching, or listening to this?
Ok, merci beaucoup. Alors peut-être je vais commencer avec la question d'Abdul. Très souvent, nous avons dans des communautés, nous faisons des audits de sécurité avec les femmes et dans lesquels nous sommes en train de voir quels sont les risques des VBG auxquels elles sont beaucoup plus exposées. Et durant ces audits de sécurité, par exemple, nous trouvons certaines solutions que nous pouvons partager avec elles. Je donne par exemple un exemple où on se dit que pour aller par exemple prendre le bois, que la femme ne soit pas seule, elles peuvent être tout un groupe, 10 10 femmes, elles vont ensemble et là, elles sont beaucoup plus protégées que quand elles vont seules. Mais aussi, aujourd'hui, de plus en plus, les acteurs humanitaires commencent, par exemple, à faire évoluer leurs actions sur terrain. Par exemple, aujourd'hui, il y a de plus en plus dans des villages ou dans des écoles où on fait des forages d'eau. Et là, ça évite que les femmes vont, par exemple, au bas-fond. Là, je parle du contexte de l'Ituri qui est différent de Goma. Nous, en Ituri, on n'a pas de volcan. Alors, et vous voyez, quand on met ces forages d'eau dans une école, dans, par exemple, au centre, au milieu du village. Et là, ça évite que les femmes puissent aller dans les bas-fonds pour aller puiser de l'eau. Et ça, elles sont protégées d'une manière ou d'une autre. Et tout cela avec surtout les audits de sécurité que nous faisons. Euh, donc,
Yeah.
plusieurs fois, ça nous aide à voir comment est-ce que nous pouvons faire. Alors, mon message
Right.
serait ceci. Aujourd'hui, il faudrait que dans des actions humanitaires, que nous puissions aussi penser à, à l'autonomisation économique des femmes. Ça va aussi beaucoup aider parce qu'aujourd'hui, dans la plupart des ménages en Afrique, la vie des familles est basée sur la femme, des fois, dans les villages. Alors, si nous pouvons nous investir sur l'autonomisation économique de la femme, ça va beaucoup aider parce que c'est un secteur que beaucoup des bailleurs oublient et négligent. Donc, c'est un peu ça. Merci.
Right. Edwin, you are an absolutely incredible advocate and a very passionate and convincing and inspiring woman. So thank you for showing us all what's possible, not just saying what's needed, but showing us. Thank you. Paolo, just coming to you, I guess a last message, and it's really great to see the work of concern and you know, thank you so much for describing that in detail. And also great to hear that Troker is working with Edwin's organization as well. But Paolo, what would be your last message to everybody listening again? Just building on the messages that you've heard from your two panelists.
Yeah, first of all, I would like just to go back to the water point and the safety of our women and actually children who are fetching the water. So I agree with Edwin. Like, this is actually what we're looking for. We're looking for whenever you cannot go and fetch the water from the water source. Because the same case we have it in Masisi. We have many water sources and they're everywhere. The problem is that sometimes basically they are below the villages and they're far away. So the best is to involve women whenever we do an evaluation and whenever we just look for a water point to where should it be. And in areas like Masisi, and I guess maybe like Ituri, I don't know, but we should count more on water networks. So like catching the water from somewhere higher and then bring it closer to the communities with tap stands based on the decision making with including women and leaders. Like women and leaders doesn't mean women and the leaders, like women and leaders in the sense of I think Edwin and Isidro gave already good messages that I totally share. The thing I can think about is that consider that what we see today in Goma, like it's just it's not an enormous part of what's going on in Congo. And what we see in Goma today it's similar to what Isidro was calling like in the 90s. We had displaced people, refugees coming from Rwanda, and they came to stay in Mugunga. Mugunga today is part of Goma. So it's very possible that the same will happen with these displaced people. So we have to think about how to support them in having a more more dignity in their lives, and to be not exposed to all these diseases we've been talking about.
Right. Thank you, Paolo. And thank you to each of you for your time and for your experience and for your expertise. And we're really, really grateful to have been able to highlight just all the work that you're doing and just the current situation and the ongoing conflict in the Congo. And I think all of us have a responsibility to try and continue awareness. And I hope that this will appeal to donors, to governments, to NGOs, to organizations, and to individuals around, and in this case, connected to Ireland, who feel that they could support and maybe know a little bit more after this webinar. So in the chat, there's an evaluation. We'd love to hear, it's really important to us to improve what we're doing. Please just fill in. It's very, very short. Please fill that in for us. And don't forget to join our next episode, which is on the 14th of August, which focuses on Sudan, another country that we really want to make sure people don't forget, and that we really continue to understand what's happening there. And you can also, of course, join us on all of our social media platforms and see the recording of this. So our thoughts and hearts are with everybody in the DRC, and also thank you to all of you for the work that you continue to do in the face of such adversity. So thank you, everybody.
Thank you.
Thank
Thanks
you,
for
Edwin.
organizing.
Thank you so
Thank
much,
you.
Isidro. Thank you, Paolo.
Thank you.